In 2018, there was 1,800,000 new cases of cancer in the US alone, which is around the population of Phoenix, Arizona. Cancer cases in the US have been on a steady increase for a long time. Pancreatic cancer has been at the forefront of scientists' research due to it having one of the lowest survival rates at around 9%. This begs the question, what is the best and most effective way to study pancreatic cancer? To answer this question, I went back to where I did my service learning at the Cancer Research at the Ozarks.
My name is Judy Hancock. I am a certified clinical research professional, and I work as a cancer care delivery research coordinator for cancer research for the Ozarks.
To find out the best way to study pancreatic cancer, we have to first understand why the survival rate is so low.
The main reason is pancreatic cancer is usually diagnosed at an advanced stage, as it is difficult to detect and diagnose early. Symptoms such as jaundice, pain, and weight loss do not generally present until a patient has advanced disease. In fact, there aren't any noticeable signs or symptoms in the early stages of pancreatic cancer.
Though the pancreas is a non-essential organ for human survival, removing it is very complicated due to the surrounding arteries. This is why radiation therapy is the best way to treat pancreatic cancer.
Well, actually, kind of like we said before, radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. There are two types of radiation therapy. There's external, which uses a machine outside the body to send radiation toward the cancer. There is also internal radiation therapy, which uses a radioactive substance sealed in needles or seeds or wires or catheters that are placed directly into or near the cancer.
The main idea behind radiation therapy is to shrink the tumor enough to be able to remove it. This makes radiation therapy effective for treating pancreatic cancer because it adds the possibility for surgery. Though there are many pros of radiation therapy, there are also many cons. Some of these cons include damaged surrounding tissue, fatigue, and the inconvenience of radiation therapy. Depending on the size and location of the tumor, radiation therapy can cause damage to organs nearby, including the stomach and the liver. This can leave a lasting effect on the patient's health. The next con for radiation therapy is fatigue. Patients that go through radiation therapy often experience extreme fatigue. This forces them into bed rest for the rest of the day and can render them useless. With patients going to radiation therapy on the daily, experiencing this can have a negative effect on a patient's psyche. Another con for radiation therapy is the inconvenience. In some cases, radiation therapy is given daily 5 days a week for 1 to 2 months. Though radiation therapy only takes about 10 minutes, this can take a toll on the patient due to the early hours and repetition. Though there are many cons to radiation therapy, they are outweighed by the possibility of removing the tumor or the pancreas as a whole. Removing the tumor is the preferred method because this leaves the patient with their pancreas. But if the tumor cannot be removed, doctors can remove the whole pancreas. This leaves the patient diabetic, but it is certainly better than having pancreatic cancer.
Pancreatic cancer surgery. One of the following types of surgery may be used to take out the tumor. The most common is probably known as a Whipple procedure. That is a surgical procedure in which the head of the pancreas, the gallbladder, part of the stomach, part of the small intestine, and the bile duct are removed. Enough of the pancreas is left to produce digestive juices and insulin, and so that's important. But a Whipple is a major surgery and takes a long recovery period. There's also a total pancreatectomy where the operation removes the whole pancreas. part of the stomach, part of the small intestine, common bile duct, the gallbladder, the spleen, and nearby lymph nodes, another big, huge surgery. And then a distal pancreatectomy is surgery to remove the body and tail of the pancreas, and the spleen may also be removed if it has spread to the spleen.
In conclusion, radiation therapy answers the question of the best way to treat pancreatic cancer. Radiation therapy is able to shrink the tumor small enough to be able to remove it or the pancreas as a whole. Again, though this may leave the patient diabetic, it is because radiation therapy that the patient might be able to live a long, happy life.